Hello! Today we are going to talk about fentanyl. We're seeing it more often in our patients, and we're definitely hearing about it more and more all the time in the news. It is cheap, it is readily available, and it is showing up in everything. It's extremely potent and it's deadly. We'll start with what we're hearing from our patients and what we are seeing ourselves. The number one thing we hear the most often is that the withdrawal from fentanyl is the worst thing they have ever experienced. Most withdrawal symptoms are subjective, meaning there is no way to measure them with an instrument for the most part. And while there might not be any clinical findings to support that the withdrawal from fentanyl is worse than it is from any other opiate, the important thing to remember here is just that if someone tells you that they are suffering, believe them. Fentanyl is highly lipophilic, which means it gets right into the brain very easily, very quickly, and takes effect almost immediately. This is great if it's being used for pain relief after a surgery or if you have cancer, but it also means that it is extremely potent and has a really high potential for abuse. Not all opiates are created equal. The morphine milligram equivalence conversion factor helps you determine how much of one medication is equal to that of another. Fentanyl is 50 to 100 times more potent than other opiates such as heroin or morphine, and carfentanil, which is rearing its ugly head, is 10,000 times more potent than morphine and 100 times more potent than fentanyl, which itself is 50 times more potent than heroin. I've included this so that you can visualize what I'm saying. All three of these vials contain the same milliequivalents of morphine. Fentanyl is being used to cut more than just heroin and what people think is oxy. It seems almost counterintuitive that not only are they using it in opiates, they're also using it in fake benzos and cocaine, in MDMA. It is pretty safe to assume that if anyone is taking anything they got from any place other than an actual pharmacy or hospital or provider, that it has at least traces of fentanyl in it. Do medications used to treat opiate addiction work with fentanyl, and do we use them the same way? Yes! Although first responders and ER personnel frequently report requiring more than a single dose of Narcan, and of course, Narcan is most effective when administered immediately. Buprenorphine products also work the same when treating fentanyl addiction. The tricky part comes when trying to determine the appropriate time to take that first dose so it is effective while avoiding precipitated withdrawal. This can become challenging because fentanyl has a longer half-life, but the withdrawal symptoms frequently begin within a couple of hours of the last use. So sometimes the patients really struggle to get through those withdrawals and to the point where it is safe to start the induction. This is further complicated by the fact that fentanyl is not picked up by the UA cups. With most opiates, including methadone, we would usually just send them home with some UA cups, tell them when their urine is clear, then they can start the Suboxone or other buprenorphine product. A person can test positive for fentanyl or norfentanyl, its metabolite, for up to 4 days. So a good rule of thumb to follow is to wait 72 to 96 hours after the last use, or until we are able to get a negative definitive test. Because the withdrawals are so bad, they have a hard time getting through that. So we can prescribe comfort meds to ease that transition for them. Can we test for fentanyl? Yes! Although Michael was unable to attend our meeting this morning, he did send this beautiful love letter. Fentanyl and its primary metabolite, norfentanyl, is part of our test menu in the definitive panels. Please familiarize yourself with the tests available on each risk panel. Fentanyl can also be ordered by itself if desired. Love, Michael. Fentanyl works much the same as any other opiate in that it binds to the brain's opiate receptors, and it's in the part of the brain that control pain and emotions and pleasure. And with repeated use, you develop dependency and then addiction until your brain just thinks you need it as much as you need air or water. Fentanyl's intended use is for severe pain, such as post-surgery or for cancer pain. It is being used to cut so many other drugs because it is cheap and because it does provide a feeling of euphoria. So while using it in cocaine may seem counterintuitive, because that feeling of elation, extreme happiness, euphoria, people don't necessarily realize they're not getting it from cocaine, they're getting it from fentanyl. It is not more expensive than other drugs. As a matter of fact, it is extremely cheap, which makes it even more dangerous because the temptation for a dealer to cut it into a more expensive drug like MDMA or cocaine or Xanax is pretty tempting. But because the consumers are unaware of it being in those drugs, there's a greater risk for interaction or for people not taking it properly. And also because it's being made illegally, there are no quality controls in place. So you really don't know what you're getting, what is in it, nor do you have any idea of the actual strength. There are inexpensive kits available to the public through organizations like Dance Safe that come with all of the reagents and charts needed for the amateur to test what they're getting at home to make sure that it's indeed what they think they're getting. With these kits, they can then test the substance before they take it rather than testing their urine to find out what they took. They can test for fentanyl, meth, cocaine, acid, basically anything you can think of. When you take fentanyl, it acts on the brain the same way any other opiate would, such as oxycodone or heroin. The difference comes from the fact that it is completely synthetic, and when so much of it that we're seeing in our patients and seeing in the news is made illegally, so there are no controls and you don't know what you're actually getting, or you might think you're taking the same amount you've always taken, but this is much more potent or stronger or not as cut. There are lots of resources out there to gather information. Some of it is geared towards providers, others towards the public. You do just want to always make sure that you are getting your information from a reputable website, not from Facebook and not from your Uncle Billy. And of course, we do have amazing resources right here at your fingertips pretty much 24/7. Dr. Mian and Michael are always very responsive and knowledgeable. If you have a question you're not too sure about or something you've not heard about before, always reach out to them. They can usually get back to you in real time with actual usable information. Look for other information coming soon. Some geared towards staff, some geared towards patients. There will be more videos and a YouTube channel coming up fairly soon that we can play in the lobby. If you have any suggestions for these things, as always, speak up. I'm happy to hear and collaborate. And thank you very much. I appreciate each and every one of you, and let me know if you have any questions. Have a great day, guys.